Have you undergone weight loss surgery? Or are you about to? Or thinking about it? Registered dietitian here. Some surgeries involve removing a part of the stomach, while others involve bypassing the stomach and connecting it to a specific part of the small intestine. That's why we need to be very careful and educated so that we don't get sick and avoid malnutrition, meet our protein requirements to heal quickly. Remember, any type of surgical procedure, it's super stressful on the body. And so that we don't overstretch the stomach over time. Otherwise, what was the point of the surgery? Yes, if you're not careful with amounts, the stomach can stretch. Obviously not to the original size, but it will stretch if you overeat and you're not careful with amounts. Sometimes the duodenum is bypassed and the stomach is directly connected to the jejunum. So it will depend on the surgery. At the end of the day, all surgeries have the same thing in common: to restrict the amount of food your stomach can hold, so that you can feel less hungry and lose weight. And this is very important for you guys to know. You're not going to lose weight right after the surgery because we are not getting rid of the fat. What we are doing instead is making you feel less hungry, limiting the amount of food your stomach can hold, so that you can feel less hungry and lose weight. So I'm here to help you transition the best way possible to a normal life, or prepare you for it. No worries, got you. I have created an online Post-Bariatric Diet Guideline with all the guidelines, recipes, and tips, and of course meal plans. It will explain everything you need to know and answer all your questions. It doesn't matter if you have not undergone surgery yet. In fact, the better prepared you are, the more successful you will be. So you can transition to a normal life the best way possible. And most importantly, in the most healthy way. And this is everything you need to know. You don't need anything else. I work at a hospital, and this is what I give my patients. So this is a template I work with my patients online, at my clinic, and at the hospital. So I know it works like a charm. Here you will find everything you need to know. As your doctor might have told you, after surgery you have to be extremely careful with what you ingest. Liquids, food, vitamins. I can't stress enough how important it is you guys know everything, so that you don't get sick. I see so many people that get extremely sick. So many people feeling awful after their surgery, when we can do so much about it. We can prevent those symptoms. You will be working with a nutritionist, registered dietitian, and a doctor, and you will follow everything they say. But if you can add this to all the things they tell you and work together with this, I'm telling you, your post-op, post-surgery, will be incredibly smooth. For example, did you know for the first 48 hours after surgery, we need to be extremely careful. But at the same time, we have to start stimulating digestive function. So it's a little tricky, I know. At this moment, you can only tolerate liquids. I know. Sorry. And here it shows how much your stomach can hold after surgery. And here you can see the post-surgery diet progression. Starting with clear liquids, then full liquids, then puree, then soft, and lastly adaptive. And as you heal and start tolerating liquids and transition from clear liquids to normal liquids, you will progress to puree. And here I have all the tips to puree your food. Here we explain dumping syndrome and how to avoid it. Totally avoidable. You have to learn to differentiate between early dumping syndrome and late dumping syndrome. We also talk about protein and how important it is you meet all your protein requirements so that you can heal fast. Guys, protein is king. Why is protein so important? These are the functions of protein in the body. Proteins are part of digestive enzymes, which help facilitate chemical reactions. All are chemical reactions in your body, so kind of important. Proteins are part of antibodies, which support immune function. And then one you guys all know, they support muscle contraction and movement. They provide support to the body. Proteins are part of hormones. And you guys know how important hormones are. Proteins also move essential molecules around the body. They move ions and cations. They help move hormones inside the cell. Honestly, I don't know what we would do without proteins. And they support the regulation and expression of DNA and RNA. Kind of important. Kind of. We also have amazing high-protein recipes that you will love. They're so good. The yes and no's for vitamins and minerals. Super important. I don't want you to get sick. And I want you to meet all your vitamins and minerals requirements. We also have meal plan samples. How to make sure you meet all your protein requirements. How many grams? And food examples. I know it can be a little tricky. How to choose a protein powder. Remember, you're not going to be able to ingest a lot of food, and we need to meet the protein requirements so that you can heal fast. So here you have all the details, all the amounts, all the servings. And super important, your protein powder must not contain more than 5 grams of sugar per serving. Otherwise, you will get dumping syndrome. And believe me, you don't want to get it. All the information you need on liquids. How to differentiate between clear liquids and full liquids. And this is super helpful. A visual fluid progression. No worries. We got you.